This is the cubital fossa bounded by brachioradialis, pronata teres. The floor upper part is formed by brachialis, and this is the biceps tendon. Tendon of biceps, brachial artery and median nerve. So the median nerve enters the forearm by passing between the two heads of pronata teres. This is superficial humeral head of pronata teres. This is deep ulnar head of pronata teres. So the median nerve enters the forearm by passing between the humeral and ulnar head of pronata teres. Then it passes deep to flexor carpi radialis, palmaris longus and flexor digitorum superficialis. So once I reflect flexor digitorum superficialis, you can see the median nerve after passing through the tendinous arch of flexor digitorum superficialis will be plastered to the undersurface of flexor digitorum superficialis, lying between flexor digitorum superficialis and flexor digitorum profundus muscle. This is flexor digitorum profundus. This is flexor digitorum superficialis. So it will be running between these two muscles at the distal third, emerging from the lateral border of flexor digitorum superficialis. See, here it rests between flexor carpi radialis and flexor digitorum superficialis, overlapped by palmaris longus tendon. So this is flexor carpi radialis, this is median nerve, this is flexor digitorum superficialis, this is palmaris longus. It passes deep to flexor retinaculum to enter into the palm. This is median nerve and brachial artery with the biceps tendon in the cubital fossa. This is pronata teres muscle. So the median nerve, you know already, enters the forearm by passing through the two heads of pronata teres. Now we have reflected the pronata teres muscle at its insertion point and deviated it laterally so that we have a clear picture of median nerve in the forearm. So this is a median nerve entering the forearm after passing between the two heads of pronata teres through the tendinous arch of origin of flexor digitorum superficialis. This is flexor digitorum superficialis tendon which is cut. These are the cut tendons. This is flexor carpi radialis. This is palmaris longus. So you can see flexor digitorum superficialis tendinous arch. Deep to that the median nerve will pass, then runs plastered to the flexor digitorum superficialis between flexor digitorum superficialis and profundus. Now these deep muscles are laterally flexor pollicis longus, medially flexor digitorum profundus. In between these two, there is a thin nerve and blood vessels resting on the interosseous membrane. This thin nerve is anterior interosseous nerve supplying the deep muscles, that is lateral half of flexor digitorum profundus, flexor pollicis longus and pronata quadratus. It is accompanied by anterior interosseous vessels. The vessel will pierce the interosseous membrane and goes to the posterior aspect. As you all know, anterior interosseous nerve is a branch of median nerve. Now this is a median nerve. I am holding it in my right hand. I will be pulling the anterior interosseous branch. You can see it is given from the median nerve. So it passes deep to flexor digitorum superficialis and reaches the interosseous membrane where it runs between flexor digitorum profundus and flexor pollicis longus. So this is anterior interosseous branch of median nerve. This branch is given before it passes deep to the flexor digitorum superficialis. The median nerve lying medial to brachial artery. You can see the muscular branches of median nerve given off. And this is the anterior interosseous branch. These are all the muscular branches of median nerve to the superficial flexors, elbow joint and superior radioulnar joint, then lateral half of flexor digitorum profundus. Superficialis is here. This is pronata teres, flexor carpi radialis and palmaris longus. So we have reflected all the superficial flexors and what you are seeing deep is profundus. This is flexor pollicis longus. So you can see the branches of median now. This is anterior interosseous branch. These are all muscular branches.